I'd like to welcome you to the first full-length course in our Visceral Osteopathy series, Part 1, treating the upper gastrointestinal tract, meaning the esophagus, diaphragm, and stomach. Let me introduce myself. My name is Maureen Maher. I'm the Educational Director for the Center for Continuing Education of Osteopathy, and I'm also the instructor for this course. I wanted to give you a bit of an overview of what you can expect to learn, specifically the type of demonstration videos that we're going to give you aside from all of the theory knowledge, so that you can have an idea of what to expect as you go about deciding whether or not you want to enroll, and as you go about deciding whether or not maybe visceral osteopathy is something that you should consider incorporating into your practice, because it's not always self-evident in every training course throughout the world that the gastrointestinal tract has a lot of effects on the body and can be very well treated through manual osteopathic therapy. So let me jump right in and give you a bit of an overview. Now, for the purposes of this course, because we're looking at the upper GI tract, and of course, even though within osteopathic principles everything is interconnected, for the sake of learning and pedagogy in an organized and incremental way, I've had to break up the entire digestive tract into sections or regions. And this course, as you know, we are going to be covering the upper GI tract, so the beginning of the digestive tract. And the upper GI tract, as you know, consists of the esophagus, the stomach, and the diaphragm, which is a very important muscle through which the esophagus transverses so that it can then dump food into the stomach. Now, a lot of things can go wrong within those areas because, as we know, things like acid reflux or hiatal hernias or other forms of dyspepsia related to the stomach are often caused by problems, like I say, within the plumbing of the upper GI tract, the beginnings of the whole system. And we see this type of phenomenon in women who are pregnant because the weight of the baby is pushing up the upper organs, or we see it in people who are suffering from emotions or nervous emotions that are related to agitation within the stomach, affecting the production of hydrochloric acid within the stomach. And we can also see spasms within the esophagus itself. And you'll see that when we come to discussing how the esophagus actually is positioned within the body and its purpose and its way of functioning, we can understand that if there is a certain degree of hypertonicity, too much stress or tension within the chest cavity, the esophagus can end up being in a state of spasm, and therefore the food has difficulty going down. So when it comes to palpating or evaluating with your hands, we're going to do it in a progressive manner, always in the direction that the digestive tract moves. So I've already said, if you think of the digestive tract like an assembly line, well, the food leaves your stomach, leaves your mouth after you swallow, and then what does it do? It starts sliding down your esophagus. It gets to the base of your esophagus, whereby it passes through the diaphragm. So the diaphragm has to be in a proper state of function in terms of its tone as a huge muscle. If there's too much tone, too much tension within the diaphragm, then the esophagus is going to have difficulty allowing the food to slide down in a natural way, the way it should, and then dump into the stomach. So we're going to be, first of all, assessing for any dysfunction within the esophagus, within the structures surrounding the esophagus, which is within the thoracic cavity. We're going to also be assessing for the diaphragm because, as I mentioned, if the diaphragm is too tight, if a person is stuck in inhalation, if there's a variety of reasons why the diaphragmatic muscle is so incredibly tight, then it is going to prevent food from going down. It's going to sit at the bottom or at the base of the esophagus, but it's not going to be able to migrate any further down its production line. So we're going to need to assess, palpate, and evaluate the diaphragm as a muscle itself and make sure that that's functioning properly. That'll go a long way towards not just allowing the food to be able to transverse through the diaphragm and dump down into the stomach, but also in relieving a lot of intrathoracic pressure. We know if a person is stuck in inhalation, what's happening is everything is getting pulled upward. There is a difference in the pressure gradient between the chest cavity and the stomach cavity, and that in itself can also cause abnormal tension or tone on the esophagus. So you're starting to see how it's all interrelated, and that's the beauty of osteopathy. Now, the stomach itself also needs to be in good function. It needs to be able to move properly in its motility and in its mobility. And so part of your palpation and testing and assessment is also going to be to test for the stomach itself. Now, in our following demonstration videos, I'm going to show you how to test for and treat the esophagus, what you're going to look and feel for within the fascia in that area, within intrathoracic cavity pressure, and then to go about treating and releasing restrictions in that area. Then we're also going to learn how to palpate and test for problems within the diaphragmatic muscle. We're going to learn how to treat that successfully in order to help it release. And then we're also going to learn how to palpate for and look for potential dysfunction within the stomach. And we're going to learn how to do that in a prone position and also in a seated position. And the beauty of learning a variety of techniques, whether it be the patient lying down or whether it be the patient sitting up, is that you have different tools in your toolbox that you can reach for depending on what's appropriate and comfortable for you and for your patient at the time. So very often when I go to perform techniques on a client, I'm not getting the result I'm looking for, or the client is showing some discomfort, I say that's okay, or the technique's not working. That's okay. You know what? Sit up. We're going to try it in a different way. Okay, now I managed to get some success with you in a seated position. Let me get you to lie back down again, and we'll go back to where we were before. So don't be afraid to move your client around. I myself flip my clients around a lot, sit down, stand up, turn over, lie back down again, all in the goal of me being able to get at them and manipulate and mobilize organs or tissues or structures in whatever way I need and whatever the circumstances see fit. Later on, we're also going to look at more advanced techniques in terms of problems like issues related to dysfunction of the stomach. And as we already discussed, the stomach can either be in one of two states. It can either be pulled up into the thoracic cavity because there's a negative pressure gradient within the thoracic cavity and it's being pulled up. And what do we get is a hiatal hernia. Or the opposite when we have gastric ptosis. Ptosis is when things are hanging down and they're saggy and weak because of weak ligaments or a variety of other reasons. And that can happen with the stomach. So you want the stomach, just like organs of the pelvis or other organs of the body, to have that natural degree of buoyancy, that it not be pulled up too much into a state of tension, and neither is it hanging down too heavy without proper tone. So we're going to learn how to work with a stomach that is in a state of tension, meaning a hiatal hernia, or ptosis, meaning that it is hanging down and we need to try to bring it back to life and give it some buoyancy. But before we can get into some of those more advanced techniques, first we're going to learn how to palpate for and locate the areas where you're going to place your hand when it comes to being able to feel for the esophagus, to feel for the diaphragm, and to feel for the stomach. Becoming familiar with hand placement and where they are so that you can actually feel for what's going on is key, obviously, for you to be able to treat effectively. And you know that I've always said within visceral osteopathy that an examination or palpation in and of itself, is also a form of treatment. So it can very naturally follow that you might be assessing a region, and now that you've actually felt and discovered what's going on, you might quite naturally want to go ahead and start treating that region versus just assessing that and saying, okay, let me move to the next region, let me move to the next region, and let me come back to it. There's a certain amount of instinctual, non-premeditated work that goes into doing visceral work. So if you have your hands on the thoracic area of your client or on the thoraco-abdominal region and you're assessing for the esophagus in relation to the stomach, once you start feeling what's going on and your hands are already there and you've already picked up on the rhythms of motility and mobility, it naturally follows that while you're there and while you already feel and have captured what's going on within your hands and within your mind, that maybe you're going to want to go ahead and start treating as well. So you'll see that in my demonstration videos, that's exactly what I'm going to do. I'm going to show you first what your proper hand placement should be so that you know where your landmarks are, so that when you're trying to feel for, let's say, the stomach, that you have your hand indeed on the stomach and not on the liver. Then we're going to start palpating, and I'm going to explain and describe to you what you should be feeling when the organ or the region is healthy or when it's dysfunctional, and then what you might go about doing in treating it. So it's going to be very fluid, and when you come to actually practicing these techniques themselves, if you want to break it up and saying, okay, you know what, I'm going to practice just for a while now on assessing and potentially treating the esophageal area, that's fine. Maybe on another session you decide that you want to start working on assessing, palpating for and treating the diaphragm, the stomach in relation to the diaphragm, the stomach in relation to the esophagus, and then maybe just the stomach itself. You say, you know what, I have clients that I want to work on their stomach with them lying on their back, and I want to be able to just be sure that I've got the hand placement for that. So you can break up your practice in learning how to master the techniques in as many different ways as you want as you go about watching these videos. And when you come to your homework assignments later, it'll be more structured in the way you go about it. Okay, so that gives you an overview of what our goal is in terms of our video demonstrations. Let's move on, let's move forward, and let's take a look.